Hey guys, it's Colleen, your friendly neighborhood abortion influencer. So listen, in a week where the Trump regime just flat out ignored a 9-0 Supreme Court ruling and left a man in a literal death camp in El Salvador over an administrative error, probably like a whole bunch of you, I just needed a win. And wouldn't you know, it came from the unlikeliest places, the YouTube comments section. So remember this one? It's my liar, liar, forced birth, their pants on fire video last week that called out Lydia Taylor and Kristen Hawkins of Students for Life, who attempted comedy, and we all came away with some serious cringe burns. Well, as I'm just getting my YouTube channel up and running, please subscribe, y'all. Help me dodge the hate algo. There's really not much engagement yet, but for some reason, this one landed in the hands of a lot of trolls. Drive-by screeching that I'm unhinged for, caring that pregnant women are dying unnecessary deaths. Or just, dudes that hate chicks, the usual. And then enter John Smith, 09123. And yes, I did imagine him in cargo shorts gripping a Monster drink in one hand and still mad about Gamergate and convinced women having opinions is the true final boss. But then something wild happened. He came back and he says, wait, hospitals are turning people away? Say what? And he posted this genuinely thoughtful, long-ass comment. And y'all, the shift was real. I'll sum it up for you. So this dude has EMT experience. He went on a long, detailed explanation about continuity of care and how if he had ever abandoned a patient in the field, he could have been fired, sued, jailed, lost his certification. And that's because of EMTALA. Do you remember this one? It's the Emergency Medical Treatment and Labor Act. It's a federal law that says if you show up at a hospital in an emergency, they have to treat you. Novel thought. It's meant to stop hospitals from turning people away, especially if they're uninsured or in crisis, including pregnant patients. It's basic common sense stuff. Show up at the ER and you get treated. So I hit John with the facts. I sent him articles from PBS News and the Associated Press who analyzed federal hospital investigations that detailed that women are miscarrying in hospital lobbies and bathrooms and parking lots. Pregnant folks are being told to come back when you're sicker. And that doctors are fearing jail time for treating patients who need abortions. So they wait, and people suffer, and sometimes they die. And hopefully this guy is now realizing, maybe for the first time, that licensed physicians in the land of the free are being forced to deny care to pregnant people due to the vague language in the GOP's draconian, cruel abortion bans, and that hospitals are breaking federal law under EMTALA, or, being allowed to break it under Project 2025's misogynist, twisted little blueprint for Christian nationalist dystopia. The National Women's Law Center explains that Project 2025 would halt enforcement of EMTALA when pregnant people are denied life or health-saving abortion care. Yes, the weirdos at the Heritage Foundation are falsely claiming EMTALA doesn't apply to abortion because they push this baseless idea that emergency abortion care is never needed. As if ectopic pregnancies, preterm rupture, sepsis, or cardiac complications are just, leftist hysteria and not, real medical emergencies. And of course, not one of these idiots has a medical degree. Unless you count whatever YouTube University course they audited between Fox News segments about Mr. Potato Head's genitalia and how solar panels are a gateway drug to communism. So their plans are more than an attack on abortion rights. It's a well-designed blueprint for letting people die quietly in the name of their twisted fetus-first ideology. Anyway, my friends, do you think I just radicalized an apathetic bro? All because of my goofy video trolling Students for Life bozos? Okay, I'm not saying he's grabbing a bullhorn and heading to the April 19th protest this weekend. But maybe, just maybe, he's gonna think twice the next time forced birth weirdos come around waving their bloody fetus fever porn around. So please guys, send this guy some good juju. Let's manifest a world where even the John Smiths of the manosphere start asking the right questions. A girl can dream. And hey, at the very least, if this guy can wake up, maybe there's hope for the rest of them. So yeah, just wanted to share that little scrap of hope among all the horror lately.